With a neck treatment, there are 3 different positions we can do this in: supine, prone, and sitting. So we're going to do 3 different demonstrations. After each demonstration, you'll have the opportunity to practice. So my favorite position is in a supine position. Find here I can access all parts of the neck, including the anterior neck, the scalene, so along stomach meridian, all through the upper traps, posterior neck, base of the skull. Right when they're lying face down, we can't get to the anterior neck. The problem with that is in this position, it's hard to do a demonstration, but you're going to get the idea. So remember, we always start with our basic principles: superficial to deep to superficial, right? So superficial techniques are largely going to be our pushing techniques. Now pushing, as we talked about before, I usually think push. We can pull as well. Now the reason I'm using my knuckles and not my fingertips is because my fingertips I get too much grip. And as we know with Tuina, for the most part, we're not using any type of massage medium. So I'm just going to use my knuckles and just start to warm up the area, introduce touch to the area by doing my gentle pushing technique. So I'm basically just following along the gallbladder meridian up to the base of the skull. I could do the same thing on the anterior neck. Again, I'm just using those nice loose fists back of my hand, not pushing hard at all. Okay. And then I'll do the exact same thing on the other side because I intend on working on both sides, but for brevity, I'm going to be working just on one side. Now, the other warm-up technique that I like to do a lot is kneading. So with kneading, we can use any contact surface we've talked about. You can use your thumb, pads of your fingers, your knuckles, whatever it might be. So I'm just going to start right up along that nuchal line, going from GB12, GB20, UB10, all the way to DU16. So basically just doing these nice, gentle circles along the base of the skull. Now the pace and rhythm that you go at is entirely up to you. You'll figure it out with your style. I like a moderate pace. I'm not going deadly slow, but I'm also not going really quick. And there's no right or wrong way to do it, with the exception of if it hurts your client, it's the wrong way to do it. So when you choose a pace, you'll find what feels most natural to you, but you'll also communicate with your partner and your clients to see what they like. Some people like a little bit more of a vigorous, faster technique. Some people like really slow, so. All right, so that's kneading, and then I'll knead right down the UB meridian and the GB meridian simultaneously, right? And then working into those upper traps right on GB21. But now I'm going to use my fist on my loose knuckles, just like this, using 3 of those knuckles. Just easier on my body mechanics. All right. Now I could do the same thing on the anterior neck, so I could go along that clavicle, starting right beside the sternum, just doing these very gentle kneading techniques. I'm getting a little deeper now than I was when I was pushing though. All the while, I'm palpating very closely to see what I actually feel. Now once we get into that SCM, I'm not going to be doing kneading like this. I'm not pushing directly down, of course, because I'll push into the carotid artery. Being very mindful of that carotid sinus. So we've got the angle of the mandible, just superior and posterior to the angle of the mandible. It's the carotid sinus. Don't press on it. So when I do kneading on the SCM, I'm just going to grip gently and kind of do this rolling back and forth technique between my thumb and index. Now these warm-up techniques, they could take 5, 10 minutes, however long you choose, because you'd be, of course, doing both sides, right? Okay. Now we're going to get into our deeper techniques. So the deeper techniques, we're going to be alternating between pressing and suppressing. We're going to be doing things like one-finger meditation and our rolling techniques, which fall into that deeper technique section, when they're in a sitting position. But here, it's largely just pressing and suppressing. So I'll start with, it doesn't matter where you start, close to the head or close to the shoulders. I'm going to start on GB21. So GB21, if I feel strong enough, I can do in a sitting position. I could use my fingers, or I can reinforce my thumb. I can even use both thumbs on one side. So if I'm standing, or rather sitting, I'll use a reinforced thumb, locating that point between acromion T1 right in the middle, the upper point of the trap, and I'll lean in. Now this hand, even though I'm not demonstrating on this hand is going to stabilize, but I never push both sides at the same time. It gets to be a bit too much, right? Remember, pressing is still relatively gentle. And during that gentle pressing, if you want, you can broaden the contact surface, right? Use your knuckles. You because we're not aiming for any type of deep stimulation. I kind of think of pressing like preparing the body for that deeper suppressing technique. Okay, how you feeling in there? It's tight now. So now to do suppressing technique, because with suppressing you want to get into the habit of good body mechanics, I would not recommend doing our suppressing technique while sitting on GB21. You can give it a try if you want, but it's best simply to stand and make sure you're maintaining proper body mechanics. So to maintain these body mechanics, I'm going to stand at the head and to the side of the table and go into that lunge position. And I'll either reinforce my two thumbs back to back. I'm going to use one thumb, I can use my fingers, whatever contact surface I feel is good. So I'm going to find that point, that deep lunge, nice and relaxed in my shoulders, and I will gradually lean in. I'm just going to use one thumb that's strong enough so my other hand will support. Tell me when we're at a 7, yeah? So all of the weight and pressure is coming from my body, not my arms. I'm not using any force from my arms whatsoever. Tell me when we're down to a 4. Now, the two ways that we know that we've held this point long enough is one, communication. We're waiting until we're down to a 4 or less, or you'll feel it. With time and practice, you'll get a sense of what it feels like when that muscle starts to relax. Okay. It's going down. It's referring down the scapula. Now I feel it's starting to twitch, and I can continue to hold this. Remember, with suppressing technique, you might need to hold it. You might need to hold it for 5 minutes, right? You usually don't. Usually it's less than a minute. In this case, yes, I'm using a reinforced thumb. You can use your fingers if you want. Now, another way that we could do this is with a strong grasping technique. But what you'll find with a grasping technique is you can hold that no problem for 30 seconds to a minute. But if you're having to hold it for a longer period of time, your thumb's going to get super tired of grasping.
For which point?
This is GB21. GB21, yeah. Okay, and then we could go back and press it a little, or after we've done our suppressing, I always do a little bit of kneading. And I'll go back into a suppressing technique. Right. Okay, so you would do that 4 or 5 times. You might spend, like I said, 5 minutes or more on that one point. But I wouldn't recommend going into it over and over and over again without doing a bit of kneading in between. You really want to do some gentle kneading because it's just uncomfortable to have it pressed and suppressed for that long. Okay. And we're going to work our way up the neck. In this case, I'm going to stop at Jing Bai Lao. Easiest way to find Jing Bai Lao without being super precise about it is, of course, to palpate. But we're essentially going in between the upper chops and the base of the skull at the halfway point, and just about 1.5 to 2 thumbs lateral to the midline, so 2 thumbs lateral to the midline. But you'll feel a hollow point in between those capitis muscles. So all I'm going to do is I'm just going to take a reinforced middle finger, or I could use my index finger. You're going to need to use your fingers in this case. Press it into the point, and I'm starting with pressing, so nice and gentle. If you want to, with your pressing technique, you can use the pads of your fingers. After we've done a little bit of pressing technique, I'm going to move into suppressing technique. So the same thing, it's a little bit deeper. Now this hand is very important. It stabilizes the neck, because of course if I press like this, and it turns, which we don't want, right? So this hand is going to be supporting. And the same thing, tell me when we're up to a 7. And then we would hold it. And you can feel the muscles just twitch underneath your fingers a little bit. And then when it stops twitching, that's usually a good indication you can relax, or we wait until our client says 4. How are we doing? A little bit of kneading. Now, while our goal is to be working specifically on the acupoints, and they're going to give you that precise location, your fingers are going to be more accurate than your textbook knowledge of where these points are. So if you're feeling along the neck and you find a point that needs some attention, give it some attention to your pressing and suppressing and your kneading techniques in combination. Now let's shift our attention up to the base of the skull. Now in this position, we could do the same thing. We're just going to rotate your head a little bit if that's okay. We can work on those points I mentioned. It's GB12, GB20, UB10, and all the way into DO16. You certainly can, one at a time, do the same thing. Press, suppress, kneading, a combination of those. But what I like to do when I'm working into the base of the skull is I'm going to use all of my fingers at the same time. My index finger's going to go on GB12. My middle finger is going to be on GB20. My ring finger is going to be on UB10. My little finger is going to go on DO16, and the same thing on the opposite side. So I place those fingers with as much precision as I can muster. So what you'll notice is I have our head and neck into flexion. I'm going to take my fingers, I'm going to scoop up into those points. So I start low, I pull up into those points, and I really curl my fingers like in a claw type shape. And once I'm in the points, I let that head rest into my fingers. You just let your head totally relax there. Now one thing is when you're first learning this technique, the head can wobble quite a bit because the head's not on the table. It's supported entirely by my fingers. Now, even though I took my time to set up the position, it doesn't feel right. I need to switch my fingers, and that's what you're going to pay attention to, of course. Does it feel like your finger's in the right spot? It didn't, so I'm just going to readjust. That feels a lot better. How's that for you? Better? Good. And now I'm just going to hold here. Like I said, we could sit and wait, and this is going to be pressing, but with time, the weight of our head is going to gradually turn this technique into suppressing. And if I want to, I can say, for example, I feel a little bit more tension, a little bit more need on GB20. So without moving any position of my hand, I'm going to push my middle finger in harder on the right. You're okay? Very strong. Or I might feel that GB12 needs a little bit more attention, or UB10. So my fingers are all there. I just change the emphasis. What finger am I pressing more with? So without shifting anything, you guys don't see much, but Kathy, I'm sure you feel a big difference as I switch my attention. Yeah, of course we could hold that for a while. Now after we've done that, just do a little bit of pushing rather, a little bit of kneading. And make it go back into the same technique. Now let's say you want to focus on just one of those points, and usually it's going to be GB20, maybe UB10, but GB20 is the most common, right? I find that midpoint. So I will turn the head just like this, so I can find the point accurately. I'll reinforce my finger, and I rotate the entire head and neck to the side that I'm working on. Laterally flex and extend, and pull my finger up. Okay? Where are we at out of 10? 6, okay. I'm going to increase till we're at a 7. So the reason I'm rotating your head and neck in this position is it takes those suboccipitals, those capitis extensors, even the extensors of the neck, and it puts them in a lax position. If we put a muscle into a lax position, it gives us access to the deeper muscles, so I can really get to those suboccipitals. All right. I'll do a bit of kneading. On the other hand, if I stretch out those extensors, I can't get deeper because those superficial muscles are preventing me from getting deeper. So if I want to access deeper muscles, everything into that lax position, and then I press. But in this lax position, you're going to want to work on just one point at a time, not all of the points with all of your fingers. Okay, that's posterior neck. We're going to do anterior neck, and then you're going to practice. I know it's a lot, but you got the points. Anterior neck, the main points we're going to be doing is stomach 12, just superior to that clavicle, basically the midway point of the clavicle, right? So I'm going to stand to do this technique. I'll take both of my thumbs on top of the clavicle. I'll roll my fingers just over top, and I'm only going to focus on one side at a time. Even though both hands are here, I'm going to say focus just on the right. So I'll stand up. Could you pull that chair out for me? Thank you. I'll stand up, and I like to stand in a lunge position. Focus on this right side, make sure I'm nice and relaxed, checking my body mechanics, and I'll increase pressure just a little bit. Start with our pressing. And go back and forth. If you feel a pulsation, move. I felt a little pulsation, so I'm going to shift to the right. There we go. So we'll do a pressing technique. We don't want to jump straight into suppressing, of course. force, right? That's going to be too much. Now, if I want to do suppressing, just on one side at a time, big breath, and you let me know when we're at that 7 on the right, okay? Good. So, one thing we can do in this position, so I've reached that 7. If I want to increase the intensity, I don't move. Could you turn your head to the left for me? Just roll good, nice and easy. Yeah. Nice and easy, turn to the left, and you'll hit that point where you're in charge of the pressure now. So whenever I can give the client charge of the pressure, they take charge of it. I do. You control. I just hold here. And it's up to them. You could turn your head left, right, do whatever you need to do, and you'll find the position that's comfortable, or more appropriately, it's ideal. Okay. And I can relax. I'm not going to hold that point too terribly long, because of course we have the subclavian artery under there. Even though I didn't feel the pulsation, we're being mindful of blood supply and blood flow, right? Just a little bit of kneading. That was pretty intense in there. All right, last what we're going to do is along that SCM where we have stomach and large intestine points. I'm not focused on individual points, it's more of a meridian-based technique. So, take this chair back, thank you. All right, so along the SCM, we basically have points coming along the anterior border, right along the belly, and the posterior border. So we've already done our gentle kneading, our pressing, our pushing techniques, right? So I'm going to move now into deeper techniques. In this case, the same thing, pressing and suppressing, but I'll use the grasping technique. Now we know what the grasping technique, if I were to do it on the traps, is that quick grasping technique, right? But I'm going to slow it down quite significantly in order to perform it as a pressing technique, because I don't want to push the neck. So with the flat part of my index finger and the pad of my thumb, the flat part of my index finger is going to scoop that SCM from the posterior side, and then my thumb is going to curl around and pull the SCM towards my index finger. Pay very close attention to if I feel a pulsation. And then I'll just gently squeeze and relax, and I'll move up and just do a very slow grasping technique, which is going to kind of double as our pressing technique. That making sense? You can get as far up as that mastoid process. You might need to change your gripping tools to the tips or the pads of your fingers as you get close to that mastoid process. And just move up and down a few times. And we're going to get into our suppressing technique. So as I went along, I felt that the majority of tension was right in line with the thyroid cartilage. That's going to be where I'll start. So scoop with that index finger, thumb comes around. If I want to lax, put that muscle into a lax position, I rotate to the same side. I can squeeze very gently, increasing the pressure. Tell me when. Okay. Better now. Good. So I very gradually increase pressure. It was too much, so I gradually decrease pressure. And the same thing, we hold it. Now what I notice here, and it's difficult to describe what you feel, but I noticed that as I started to increase the pressure, the tension, what I felt, the location of tension changed very quickly. It was almost like the tension was trying to run from my fingers, right? Run from the grip. So then I'll switch position, because I moved a little bit more lateral. How's that spot? Going into the head. Yeah, the SCM is a big culprit for tension headaches and migraines. We usually blame the upper traps and the levator, which certainly do contribute to tension headaches and migraines. But my experience has shown that the SCM is a bigger culprit when it comes to tension headaches and migraines. Sorry, a little bit of kneading after that. Now, when it comes to any treatment of the head and neck, and we would then do our finishing techniques, nice, gentle pushing techniques, right? When it comes to any type of treatment of the head and neck, when we're doing deeper work like this, we always end by pushing towards the body. And the last thing we do, and this is, it's vital that we do this, is we have to stabilize. So at the very end, all I get you to do is just push into my right hand for me for a few seconds. This is isometric contraction. You can and relax. Now push against my left hand. Good, relax. Alright. And I always like to finish with just a little bit of traction. Big breath in, and when you breathe out, just let that neck relax. Those thumbs are just hanging out there. Excellent. Alright. So it's a very basic routine on the neck in supine position. Again, we're going to learn how to do this in prone position and in a sitting position. Sound good?
Mm-hmm.
All right. So give it a try.